I wanted to share with you this recent pelvis here that I've built. Very important to help patients understand what's anterior and what's posterior, because often pain generators are going to be either an anterior pain generator, which are going to be the intervertebral discs, or related to anterior flexion versus the posterior elements. So this model has been, you can see we've got crafted from a real specimen, but this one actually demonstrates, you can see gentle SI movement, subtle SI movement, along with the pubic symphysis. So you can see how the pubic symphysis will actually move relative to the SI joints. This is an interesting specimen because you can see here there's a small little osteophyte that's developed, and you can see some bone reaction here. You can see the raised pubic rami here, and very likely this specimen had a hypermobile left SI joint. So very easy. Now you can show that dynamic flexion, right? Flexion will create compression on the intervertebral discs, quite simply, versus extension will load, stress shield the disc, but the facets are loaded. So just the basic principle of demonstrating how important it is to keep the lumbar spine in neutral load as it relates to the intervertebral discs. So I don't know, it's patients get it so fast and they understand so clearly, and they often say, I didn't know that bending forward causes compression on the intervertebral disc. So anyways, there's a model that now makes things a lot easier for me. What's also very interesting about this new pelvis model is that we can demonstrate motion, palpatory motion associated with these SI joints and other anatomical landmarks. You can see if you press on this PSIS, you can actually get movement of all sorts, but mainly of this one particular SI joint. You can do the same on this side. This here, this little block is out of this whale spine here, and I have suspended above the treatment table, but you can see I've cut out a section of the vertebrae just to hold the lumbar spine stable as I demonstrate motion palpation. What I find interesting about this pelvis model is now we can see what's moving when we push on certain structures. So for example, this is a common presentation, and we can motion palpate. You can see how that right SI is moving a little bit. And by just pressing on anatomical landmarks, you can get a better understanding by asking regarding patients. You can ask a patient whether it hurts when you press on the SP, for example, of L5 and push anterior. Or if you press on the sacral base and you get a gapping of 5-1. So you can press here. Now a very powerful tool in the differential diagnosis of anatomical pain generators.